Hello, this is Kim Jong-il. Today's topic is part 2 of strategic leveling and alignment, and we will discuss strategic bonding. Attaching brackets to all teeth is called full bonding or simple leveling. On the other hand, strategic leveling means not bonding the teeth in front of the terminal molars in order to upright them. There are two important aspects of strategic leveling, which are strategic bonding and use of open coil spring. In Part 1, we have already learned about the use of open coil springs. Today, in Part 2, we will discuss strategic bonding. Strategic bonding is performed to make a good use of the open coil spring. Let's review the purpose of the use of open coil spring. Open coil spring can be used to create space for decrowding, upright meshily angulated teeth, and derotate meshily rotated teeth. Bracket system for non-extraction treatment should be considered. There are SWA bracket and Kim's bracket. Kim's bracket is an SWA type bracket with 0-degree torque in the upper and lower anterior teeth. This will be further explained later. There are 10 fundamental keys that are important in strategic bonding. Key 1: do not attach the teeth in front of the terminal molars. Early in the treatment, the first molar is not bonded if the second molar is the terminal molar, or the second premolar is not bonded if the first molar is the terminal molar. Key 2: do not attach crowded teeth. Occasionally, there is a crowding on the upper and lower lateral incisors or canines, or there may be a crowding on the second premolar. Depending on the type of malocclusion, the brackets can be attached to the upper central incisors, lateral incisors, and first premolars, or central incisors, canines, and first premolars. If there is a vertical height discrepancy on the upper canine in relation to adjacent teeth, the upper canine is not bonded at first. In this case, the upper central incisors, lateral incisors, and first premolars are bonded. If there is a crowding on the lateral incisor, it is bonded later. On the other hand, if there is no vertical height discrepancy on the upper canine, it means that the upper lateral incisor has ectopically erupted palatally. So the upper canine should be bonded at first in order to create space for the lateral incisor. Therefore, in the beginning of the treatment, the brackets should be attached to the upper central incisors, canine, and second premolars, or central incisors, canines, and first premolars. In the intraoral photos, crowding on tooth 13 is observed. At this time, do not attach the bracket on tooth 13. Attach the bracket on tooth 14 but not on tooth 15. Then use open coil spring on tooth 13 area. As a result, the incisors may become labially inclined, and the first premolars move posteriorly. Since the bracket is not attached on the second premolar, the posterior movement of first premolar is larger than the anterior movement of the incisors. At the same time, the second premolar may become under-erupted or move palatally. But there is no need to worry because space for the second premolar will be created by first aligning the incisors at the current position, and then derotating the meshily rotated first molars. Key 3: if the lower premolar is meshily angulated, do not bond the tooth in front, which is the lower canines. In the intraoral photos, mesial angulation of the lower first premolar and crowding on the lower canine are observed. What will happen if all the teeth are bonded? It is very likely that the lower incisors becomes labially inclined. In order to align the teeth in normal overbite and overjet, the canine is not bonded. An open coil spring is used in this area. In this way, the mesially angulated first premolar can be uprighted while maintaining the current positions of the incisors. If the second premolar is mesially angulated, the first premolar is not bonded. Key 4. If the upper canine is labially displaced from the arch, do not bond the upper canine at first, because full bonding increases the likelihood of gingival recession of the upper canine. The arch should be maintained when aligning labially displaced upper canine. Key 5. When resolving lower anterior crowding, the force vector should always be considered. In case of lower anterior crowding, it is difficult to attach the brackets to all the teeth in correct positions, and it takes a long time to align if superelastic arch wire is ligated in all the teeth. By strategic bonding and use of open coil spring, it is easy to derotate the incisors and create space. In some cases, lingual buttons can be used to apply favorable force vectors. Key 6. First align the anterior 8 or 10 teeth. After the alignment of anterior teeth, open coil spring is used in the first molar area to upright or derotate the second molar. Key 7. Bilateral and unilateral crowding should be differentiated. In case of bilateral crowding, the chance of labioversion of the incisors increases during alignment, and the left and right sides move differently. By aligning one side at a time, labioversion of the incisors can be minimized. The force vector should be considered in case of unilateral crossbite, unilateral crowding, and bilateral crowding. In unilateral crowding, the anterior teeth will be slightly labially inclined, but the teeth will move in the direction of correct midline. However, in bilateral crowding, there is a high chance of labioversion of the incisors. In this case, it is advisable to first align tooth 23 and then create a space for tooth 13. In the bottom case as well, tooth 23 should be aligned before creating a space for tooth 12 in order to minimize the labioversion of incisors. Key 8. In case of anterior crowding and open bite, first align the anterior teeth and then upright or derotate the posterior teeth. However, the posterior teeth may first be uprighted or intruded by using MOWOW, modified offset arch wire, or MIA early in the treatment. Keep in mind that the patient needs to use elastics early in the treatment, and the thick rectangular wire can cause much pain. Key 9. In order to first derotate or upright the terminal molar, open coil springs can be used in 3-4 areas. It is best to align the anterior teeth before using open coil spring in the first molar area, because there is a high chance of labioversion of the incisors when first derotating the terminal molar. Therefore, when using 3-4 open coil springs, 0.616 0.22 SS arch wire with crown lingual torque in the anterior teeth must be used. Key 10. In case of severe curve of SPE, the molars are uprighted by the use of open coil spring. However, since the incisors can be slightly labially inclined, mini screws can be used in the mandible to minimize labioversion of the incisors. The first important point in strategic bonding is if the brackets can be attached in the correct position. In this photo, crowding on tooth 32 is observed. This tooth can be bonded if the bracket can be attached in the correct position. Attach the brackets between the lower second premolars and make bond on the first molar later. The same goes for this patient. Tooth 12 is crowded and meshily rotated. When the center of tooth 12 is marked, the bracket can be bonded in the correct position, so the brackets are attached between the upper second premolars. In other words, in the beginning of the treatment, the brackets are attached on the anterior 10 teeth and second molars but not on the first molars. In case of lower anterior crowding, it is difficult to resolve crowding if all the teeth are bonded from the beginning. Therefore, the brackets are not attached on the crowded teeth. An open coil spring is used to derotate and create space to more easily resolve crowding. So far, we discussed the 10 important keys of strategic bonding. There are a few additional important points. In the photo, crowding on the lower incisors and canines is observed. In non-extraction case, whether to treat the upper arch first or both the upper and lower arches at the same time. I first level the upper arch and then start the treatment on the lower arch after a month or two. If the upper arch is aligned first, it is expanded and space for alignment of the lower arch is created. In the photo, you can see that buccal overjet is created as the lingual inclination of the upper canine is somewhat resolved. In other words, space to resolve lower crowding is created. Therefore, in non-extraction case with lower anterior crowding, it is advisable to first level the upper arch and then the lower arch. Additional key 2 is the cases of full class 2 or half class 2 canine key. In case of full class 2 with large overjet, twin block appliance is used first. If the overjet is normal, the brackets are strategically bonded on the upper central incisors, lateral incisors, first premolars, and first molars. Let's take a look at this patient. Canine key is full class 2 on the right and half class 2 on the left. The upper first premolars should be moved posteriorly by using open coil springs in teeth 13 and 23 areas. Therefore, the brackets are strategically bonded on the upper central incisors, lateral incisors, first premolars, and first molars. Then, open coil springs are used in teeth 13 and 23 areas, and tight cinch back is performed. Since the second premolars are not bonded, the first premolars move posteriorly. Half class 2 canine key becomes almost normal class 1, and full class 2 becomes half class 2. Then, lingual buttons are attached on the palatal surfaces of teeth 14, 24, 16, and 26 in order to move the palatal cusps of teeth 14 and 24 posteriorly. Let me explain again with pictures. Attach the brackets to the central incisors, lateral incisors, first premolars, and first molars. And use open coil springs on teeth 13 and 23 areas on 0.16 SS wire with tight cinch back. The expected tooth movement is as follows. As the buccal cusps of the first premolars move distally, the lingual cusps move mesially. This mesial movement of the palatal cusps is not good. So in order to move the palatal cusps of the first premolars distally, lingual buttons are attached on palatal surfaces of the first premolars. And first molars and energy chains are inserted. As a result, the mesially rotated first molars are derotated as well. Class 1 canine key is achieved on the right side. Then lower anterior crowding is resolved, and open coil springs are used in the first molar areas. Lastly, mio is inserted to finish. How long did the treatment take? The treatment began in January. Open coil springs were used in the upper canine areas in order to establish Class 1 canine key. The lower teeth were bonded and leveled, and then finished. Even though the eruption of lower second molar was weighted, the treatment took only 1 year and 2 months. In case of full Class 2 or half Class 2 canine key, keep in mind that the brackets are attached to the upper central incisors, lateral incisors, first premolars, and first molars, and the first arch wire is 0.14 any tie. Then, open coil springs are used in the canine areas on 0.16 SS wire with tight cinch back. In this way, half Class 2 canine key is quickly improved. However, in case of full Class 2 canine key, lingual buttons should be attached on the palatal surfaces of the first premolars and first molars, with energy chain inserted to improve occlusal relationship. This is retrusive control, and it will be discussed in upcoming lecture. Then, attach the brackets on the canines and re-level. If there is no vertical height discrepancy of the canine, use 0.04T NET wire, and if there is, use 0.16 SS wire with step and open coil spring, and NET overlay on the canine. In this way, the anterior 8 teeth can be aligned with relative ease. Then, by using open coil springs in the second premolar areas, the meshally angulated first molars are derotated. Additional key 3 is establishing Class 1 canine and premolar keys. This patient has a half Class 2 canine key, so the first premolars should be moved posteriorly by using open coil springs in the canine areas. In the mandible, the first and second premolars should be moved anteriorly by using open coil springs in the first molar areas. In order to make the treatment easier, open coil spring can be used in the lower second premolar area to move the lower first premolar meshally, and the distal movement of the upper first premolar results in Class 1 canine key. Finishing becomes easier if this is handled during leveling. These rotated teeth are called winging teeth. First, the relationship between canine and premolar is observed. In order to form a Class 1 canine key, the lower second premolar should be moved anteriorly by using open coil spring in the lower first molar area. How should the brackets be attached in order to align the meshally rotated winging upper incisors? Even if the upper incisors are winging, it is better to bond them at the same time. By using open coil spring between the brackets of teeth 11 and 12, it is easy to align winging teeth. Many orthodontists use mini screw during leveling. Let's compare the mini screw and strategic leveling. Mini screw is simple but has some problems. First, even though it is simple, it requires surgical procedure and may fail. The force level may vary depending on the position of mini screw. When the teeth are fully bonded, it will result in traumatic tissue reaction. Also, the force direction of the mini screw is mainly intrusive. The main tooth movement pattern with mini screw is the posterior movement of the upper dentition. It is mainly used in adults rather than growing patients. There is little mention on the occlusal plane. On the other hand, in strategic leveling, not all patients are treated with the same bracket bonding sequence. Therefore, individualized treatment is possible for each patient. Brackets are strategically attached, which allows for more physiological tooth movement. Strategic leveling can be applied in both the upper and lower arches, and in adults as well as growing patients. The occlusal plane can also be flattened. The treatment direction can change depending on whether the craniofacial complex is a changeable or unchangeable structure. If the craniofacial complex is an unchangeable structure, there is not a big problem with using mini-screw to retract the entire upper and lower dentitions. However, if the craniofacial complex is a changeable structure, retraction of the upper and lower dentitions can move the mandibular condyles posteriorly and lead to temporomandibular disease. Recently, the craniofacial complex is considered as a changeable structure. Therefore, rather than unconditionally retracting the upper and lower dentitions, force should be applied in a way that can move the mandible anteriorly. In addition, when mini-screws are placed, the left and right positions can be different. The vertical height can also vary depending on the position of mini-screw when retracting the upper dentition, which can cause vertical dimension discrepancy and, in turn, midline deviation. This is a patient with curve of Spee. In this case, both simple leveling and strategic leveling can flatten the curve of Spee, but the incisors will be more labially inclined by simple leveling. By strategic leveling, the molars can be uprighted while minimizing labioversion of the incisors. This means steep POP can be flattened. Thank you for watching.